Hello, good evening, and welcome to Enfield's Black African and Caribbean Communities webinar for the COVID-19 vaccine. We're so delighted that you could join us tonight to hear from experts and community leaders. I'd like to take you through the agenda for the evening. So we have, following my introduction, I'm going to be handing over to the chair, Sadie Fredericks, chair of North Middlesex University Hospital, NHS Trust. We have our speakers and experts for the evening, Adam Mapani, nurse consultant at Moorfields Eye Hospital, and he will then follow to Mildred Johnson, clinical director of pharmacy and medicines optimization at Maidstone and Tunbridge NHS Trust. We will then go to Pastor Nick Chanda of Revival Christian Church of Enfield, and then we will go into a Q&A panel. The Q&A panel will have all the experts that we've had already, and additionally we will have Aveta McInnes from the Enfield Caribbean Association, Dr. Lanray Durajaya from Enfield as an Enfield GP, Dr. Nitika Silhai, Enfield GP and a governing body member of NCLCCG, North Central London, Sita Chichambo, Divisional Director of Nursing from North Middlesex Hospital, Ben Mensah, Head of Nursing at Enfield Division at BEH, Barnet Enfield Haringey Trust, Adam Mapani, as we know, our experts, and Mildred and Pastor, as discussed. And finally, then we will wrap up with concluding remarks from Marcus Riddell, who's Head of Equality and Inclusion, Evidence and Policy, NHS England and NHS Improvement. So an action-packed evening. We're so happy and glad that you could make it, and hope the information provided helps in your decision-making process regarding the vaccine, and is helpful session all round. So that's our agenda for this evening. We'll have 3 speakers followed by Q&A. We'd like to hear from you, so please do submit your questions via the Q&A function on the panel. And before I hand over to the chair, we would like your feedback on the following questions. So this is question 1. Question 2. Question 3. And question 4. That's great. So thank you very much. That's really helpful. So now I'm going to hand over to the chair for the evening, Sadie Fredericks, the chair of North Middlesex University Hospital Trust, A real warm welcome to you, Sedi, and really delighted to have you chairing this meeting. Thank you again.
Thank you very, very much, Riyadh, and welcome everybody to this very, very important event. As Riyadh has said, I'm Sedi Frederick, and I'm the chair of North Middlesex University Hospital NHS Trust, affectionately known as North Mid. This is the fourth of a series of webinars organised via the Enfield Integrated Care Partnership, which is a partnership of North Mid, Barnet, Enfield and Haringey Mental Health NHS Trust, the CCG, the voluntary sector and the local authority, Enfield Council. These are being coordinated by Riyadh Karim, Interim Head of Primary Care Commissioning, Enfield Directorate, NHS North Central London CCG, and Dudu Arami, Consultant in Public Health, London Borough of Enfield. And on behalf of us all, can I thank you, Riyadh, Dudu, and your team, Katie, Louisa, Marek, and Ngozi, for putting on this important event. These webinars have been aimed at communities who have, for reasons, have a high level of decline and low uptake of the COVID vaccine. And we know that these groups are similar to those who are disproportionately affected by COVID-19. So far, these webinars aimed at specific communities within Enfield have attracted hundreds of people to these live events, which are recorded and have been viewed thousands of times on YouTube and Facebook. The feedback has been very positive, and we know that these have helped people to become more informed about COVID-19, vaccines and the vaccination programme that have been offered and rolled out right across the borough. This has been a real team effort, and as I mentioned, a number of organisations working on behalf of the Enfield communities are working very, very hard and have been working hard throughout this pandemic to support local communities through difficult times and more recently through the vaccination programme. It's not my intention to speak for very long because it's really important that you hear from the experts this evening. And I'm also very pleased that we will have what I hope will be a lively Q&A and discussion with the panel members who will be introduced in more detail a little bit later on. So without further ado, I'd like to do hand over to.
Hello, good evening, everyone. Welcome to this webinar. I would like to start by thanking the organizers for this meeting, for inviting me, for inviting us to share our practical and relevant clinical experience of COVID vaccines. So my name is Adam Mapani. It's such a pleasure to be on this platform. I'm a nurse consultant at Moorfields and I'm a clinical teaching fellow at UCL. So if you ever need any services at Moorfields, please, when you visit, feel free to stop me. In terms of disclosures, I must say I've got no connections whatsoever with the pharmaceutical companies that are the manufacturers of the vaccine. So I'm not being paid any honorariums for this session. It's out of from a pure heart, and I'll be summing up some of the reasons why I'm involved with all these initiatives. So I've proudly served in the NHS for 20 years. Out of those 20 good years, 18 years looking after people's eyes, because I believe people's eyes matters. So from a lived experience, frontline wise, I've seen quite a number of challenges related to COVID-19. And I would like to start by saying I've had COVID-19, the actual virus itself, in March last year. And I'm so grateful that I've escaped unscathed. Sadly, we have lost friends, colleagues, and relatives. And I think for me, that was a turning point in terms of adopting new lifestyle, but being more aware about exactly what this COVID virus was all about. I'm not going to go much into the details on what a vaccine is all about, but I'm just going to give a quick summary that a vaccine helps us to develop immunity by imitating an infection. Vaccines contain a dead or weakened version piece of a germ or microbe. So therefore, vaccines stimulates your immune system to produce antibodies. So just like some of you on this platform, you may have questions. So I've had vaccines. I've had the Pfizer vaccine in January. I had the second dose in March. But before I had those vaccines, I had lots of questions just like you. I was worried about the real and potential side effects. I was also worried about the amount of misinformation that was circulating on social media platforms. But I was also cognizant as well as the politicization of the science. And being someone of ethnic group, Black minority ethnic group, originally I'm from Zimbabwe, and I'd seen the disproportion of COVID-19 in my population groups. So I also had certain thoughts about the vaccine itself. But then the moment I had a blue light moment, light bulb moment, is that I realized that vaccines are not anywhere new. Currently in the NHS, there's lots of vaccination programs. There's the flu vaccination programs. But I think even if we look at the history of our childhood, we get vaccines at different stages of life. At 1 year, 2 years, MMR vaccines, HPV vaccines, and so forth. And with the flu vaccines, I also understand that there is certain hesitance again within the BAM community. So when it gets to this time to that time of the year, autumn, people, when those responsible for vaccination programs for flu vaccines in NHS, there's quite a lot of hesitance from a lived experience. Now, for me, I had to seek the support of my family, which could be something like yourself, you might be experiencing having questions. I also had to seek expert opinion from my colleagues. But being also someone of faith background, I also spoke with my pastor. And I was so grateful that consistently the message that I was getting and also a practical and clinical experience that I've experienced during the COVID crisis, I think I made a reasonable decision to have the vaccine. But some of the reservations that I know from people as well, from that lived experience, we are worried about why those vaccines have been produced so quickly. Listen, we are facing a global public health emergency. The process that normally would take several years has been achieved within a shorter space of time. This is mainly around the amount of investment that has been put into developing the vaccines. Technology has also taken center stage, not in terms of transforming our healthcare, but as well as the COVID vaccine themselves. So we've got regulatory bodies like MHRA that are responsible for regulating all the medicines and the medical devices. So lastly, as a community, I would like to say that we've gotten all, this is an all generational game changer for all of us. We can do this as a BAM community. Let's go for vaccines. It's safe, it will protect you, it will protect me, it will protect the next generation, it will protect your friends and family. COVID vaccines are for everybody. There's no COVID vaccine specific for population group, it's for everyone. There's real-time data and evidence that it's safe. So therefore, please, let's go for it. Yes, there might have been issues in some areas. We know in Nigeria, in Kano, there were quite issues around vaccines, but this is things in the past. We are in a crisis, we're in a pandemic. Please, let's continue and let's, as a community, call that service provider, let's get the vaccine. Thank you for your attention.
Adam, thank you very, very much indeed. Your comments remind me very much of one of the underlying tenets in the development of understanding of vaccines amongst all kinds of communities. And to paraphrase, it's about trusted people and trusted places. So it's really important that working with the community here, people who are embedded in the community, who are known and respected in the community, is a really important part of building confidence across the community. So thank you very, very much indeed, Adam. A really, really good start. Now, could I perhaps ask for our next speaker, Mildred Johnson. Mildred will be taking us through a slide presentation and speaking to various slides. So I'm going to hand over now to Mildred, and welcome, Mildred, to this evening's event.
Many thanks. Thank you very much. It's a pleasure to be here with you all at North Central London. I'm from Kent, a different part of the country, and I'm really pleased to be here, firstly because I have lived this experience, this journey for the uptake in my organisation, and I'm pleased to say that in my organisations we've passed the 90% mark in the uptake, and the only difference between the white group and the black group is a 0.9%, so in the 90s. So I hope that today I will be able to share some of the experiences as well. What I want to start with is about vaccines, which Adam has kindly expressed how vaccines are important. All of us in our lives would have had immunization. Vaccines save about 2 to 3 million lives a year. The COVID vaccine is not different. The intention of the COVID vaccine is no different from any other vaccines. So in the world, there has been 140 million cases of COVID-19 disease in individuals. And sadly, 3 million people have lost their lives. Can you imagine that 3 million people is the whole population of Jamaica? It is also the whole population of Africa, Gambia in the West African part of the continent. So can you imagine that? It equates to a whole country population. So it's important that we really, really consider this vaccine, and I hope something positive will be taken from today's session. So the first slide, please. So the first slide is about who are most at risk of COVID-19 disease. There's a lot of evidence from the data from the first wave, the second wave. We now know that older people are more at risk. So the older you are, the more risk you get. Male, if you're male, sadly, you're more risk than female. There's also evidence quite a lot now that if you have underlying health conditions like diabetes, obesity, severe asthmas and other health conditions, you're more at risk. People living in deprived areas, there's a big difference there in terms of where you live. If you live in an affluent area or deprived area, the more deprived area you live, the more you're at risk of COVID-19 disease. And quite sadly as well is about your origin. So if you're from a Black, Asian or ethnic minority group, you're more likely to be diagnosed with COVID compared to your white counterparts. And you're more likely to die, sadly, from this disease compared to your white counterparts. So there is quite a disparity there, inequality there between how COVID affects different communities. Next slide, please. So before I go to that slide, I was going to just talk about some of the potential reasons for the high increase in the risk in ethnic groups. As I've mentioned, the underlying condition, if you have an underlying condition like asthma, hypertension, diabetes, you're more at risk. The sad thing is those common conditions are quite prevalent in our society, in our community, very prevalent. And in fact, there's a study by one of the professors in Manchester, Professor James Nasru. He actually did a study and found out that for Black and Asian people, they tend to start having poor health conditions at a younger age. So when people say, oh, COVID is for older people, it's only older people that get COVID, that may not apply to our society, to our communities, because there's evidence to show that we get these underlying conditions, diabetes, hypertension, at a much younger age than a white counterpart. I think the age difference was between 46 and 50 in the Black group, and I think it was about between 61 and 70 years, you start getting poor health. More people start getting poor health within the white community. And with the Bangladeshi community, it was very much lower. I think it was in the 30%. So as you see, more young people of Black, Asian, and ethnic minority group will get COVID at a younger age, because the evidence is there that we have poor health at a much younger age. Next slide, please. So this slide here just confirms the link between COVID death and some of the comorbidities. So I've taken diabetes here, and it's the same trend if you look at hypertension. So if you look at the arrows there, it shows that within the group of Black British people that died, in a number which is 1,541, compared to the white group, which was over 26,000, within the 1,500 people that died in the Black group, 44%, a staggering 44%, 0.5% of those people had diabetes. But within the white group, which was 26,000 plus that died, only 17.8% of them had diabetes. This is showing that there is that underlying risk there for us being Black, and also with a high number of underlying conditions like diabetes and hypertension within our communities. That puts us at a higher risk. Next slide, please. Thank you. So let's look at closer to home. So this slide is a slide for Enfield. And what this slide is looking at, it's looking at the rate of COVID infections in the community. If you look at the arrow, so the arrow that's pointing to the horizontal line, that's the average cases of COVID in Enfield. So we've got there 2,552. But when you look at the divide, there is a divide there, because most of people in the white group, the white British and white Irish, who have these, the numbers within those groups that are being infected, that are having COVID, is much lower because it's below the average line. But for Black African, Black Caribbean, and other groups like Bangladeshi, Pakistani, it is quite above the average, showing again that more of us within our communities are being affected at a higher rate than our white counterparts. Next slide, please. So again, looking at the same trend with deaths in the community in Enfield, you're seeing more Black Caribbean and Black African people, more of them dying than white counterparts, well below the our white counterparts are well below the average deaths, whereas our deaths in our communities is rocketing at 187 there per 1,000 population in the borough. Next slide, please. Thank you. So, as a pharmacist, a clinician, I would say, and a Black woman, I know what the risks are. And I know that the risks are higher for COVID-19 within our communities. The sad thing is, at the same time that the risks are high, it is alarming to know that the greatest hesitancy is within our communities. This study here by Sage showed that the hesitancy on willingness to take the vaccine within the Black group was 72%, whereas the willingness within a white group was 82%. They were willing to take the vaccine at that rate. Also, when the vaccination program started, and this is a January data, nationally, only 20.5% of Black people over 80 who are very much more at higher risk were taking the vaccine compared to the white population, which was 42.5%. And again, it goes with the deprived area. And again, it goes with some trust, some hospital trust, where the rates were very, very low. Hence, there's a lot of push to have this campaign and to spread the message, the real message about the evidence. Next slide, please. Thank you. So now let's look at the uptake. So in Enfield and NCL, the uptake so far is that within the Black community, the uptake is 38.7%. And that is in Enfield compared to NCL, the whole of NCL, which is 34.8. What we can see here is that within the Asian community, the rate is at its highest across the spread, so at 62.8%. So how could the Asian community turn the corner and then we are left behind? What is the reason? If the Asian community have moved on, they are increasing their uptake, and we are still not increasing our uptake. What is the reason for this? Next slide, please. This is just for information for those who live in the borough. It shows the breakdown of the uptake within the Black community across the borough. And sadly, Camden and Islington are falling behind. Enfield is slightly ahead there. So this is just for information to know what the spread is and the uptake is. Thank you. Next slide, please. I must say that the vaccination program has been remarkable. I think if you go and ask in every quarters, they would say that it has been remarkable. And this is the reason. If you look at the squiggly lines, it shows that since the vaccine program, there's been a 3-month trend in decline of not only the deaths from COVID disease, but also the cases of COVID infection and also hospitalization, all have declined since the start of the vaccine program. This is evidence that the vaccine must be working. If you consistently see this declining in the cases, that is evidence that the vaccine itself is working. Next slide, please. So, with regards to the questions, there are 4 burning questions that most people would be asking. One is, does the vaccine itself, does it protect against COVID infection? And does the vaccine reduce the severity of the infection? Also, people would want to know if the vaccine actually prevents them from dying from COVID. And probably another very significant question is the vaccine really safe? Those are the burning questions that most people want answers to. Next slide, please. So I'm going to walk through the evidence for this very briefly. So the first study in terms of the effectiveness of the vaccine is the Siren study. So this is a recent study and was put together when healthcare professionals were the first people to be vaccinated. And they looked at the rate of infection amongst those healthcare staff that have taken the vaccine. And the result after 21 days showed that the vaccine was preventing COVID infection amongst the healthcare professionals at a rate of 72%. That's a high number. So 72% effectiveness in those groups. Next slide, please. The next study I want to show you is called the real world study. So this is a study in over 70-year-olds. Remember, those were the first groups that we were vaccinating. and it looked at the effectiveness of the Pfizer and the AZ vaccine. What we can see here is, even after one dose, either vaccine is roughly about 70% effective. But not only that, we can see that there's an additional benefit from the vaccines. So you get a reduction in your risk of emergency hospitalization, a reduction in your risk of death as well. So what the scientists have done is they've combined all these outcomes, and the combination effect is that for a single dose of either vaccine, you prevent hospitalization by 80%. And a single dose of Pfizer will reduce death by 85%. So those are real high numbers, very good numbers. Next slide, please. So the next slide is another study from one of the world's leading country in terms of the number of doses that have been administered to the population, and that's in Israel. England is fourth on the table currently, but Israel has been way ahead of every other country in the world. So they looked at the effectiveness, being that they vaccinated so many members of the population. They looked at how effective was the vaccine. And the vaccine to prevent COVID disease was about 90+%. So it prevents it at a rate of 90+%, compared to about 46% to 57% if you don't have the vaccine. The other thing to look at is hospitalization. So hospitalization was prevented at a rate of 87% compared to 74%. And severity of the illness, those presented with severe illness, was prevented at a rate of 92% compared to 62%. And most importantly, it prevented death at a rate of 72%. So very, very encouraging numbers. Those who are scientists here would know and would testify that those are good numbers. Next slide, please. So I'm going to now talk about AZ. This is very important. It's quite topical. There's been a lot in the media, in the news about AZ. So AZ has been on the spotlight because of a very rare clotting that has occurred after a small number of people were vaccinated with AZ vaccine. There's a lot of evidence that is being put together and compiled as we speak by MHRA. So the evidence are firming up, but it is still not confirmed, not fully confirmed, that there is a clear association with the vaccine, although the evidence are firming up. So scientists would now are now tasked with checking and looking at every case, every evidence, to see and identify for certain that there is a link between the vaccine and these side effects. But because the incident is so rare, the MHRA has advised that the benefit outweighs the risk. The benefit of the vaccine, it does outweigh the risk. So we should continue to receive the vaccine. They've, however, taken some caution in under 30s and pregnant women who must now be offered an alternative vaccine. Next slide, please. So to bring that into context for you, I thought this was a powerful slide. And what this slide shows is it compares your risk of side effects, of harm from the AZ vaccine compared to other incidences. So let's focus on the 55-year-olds. So the risk for the vaccine side effect is 4 in a million. That's to do with the thrombosis that has been in the media. So it's 4 in a million. But your risk of dying with COVID is 800 in a million. So if you get COVID, you're 200 times more likely to die compared to you taking the vaccine. So which would you choose? Would you choose the vaccine, or would you choose not to be vaccinated and risk dying from that rate at 800 in a million? So for other things where there have been documented risks is dying from accident. So you're 180 times in a million more likely to die from an accident to 4 in a million from taking the COVID vaccine. So if you put it into context, now you see why it is still better to take the vaccine, because the risks of not taking the vaccine is higher than the risk of having a side effect from the vaccine. Next slide, please. And this is my last slide before I conclude. And I thought this was a good slide too, because it actually highlights the risk of other probably habits that some of us engaged in, like smoking. So if you're a smoker, you're 1,763 times in a million more likely to get a clot. Whereas with a clot from AZ vaccine is only 4 cases in a million, so 4 in a million. With COVID infection, and that's infection, so the figure I gave you earlier was if you're dying from COVID, this is getting the infection. You're 165,000 cases more in a million to get COVID infection. That is 165,000 cases in a million compared to 4 cases in a million if you're going to be at risk of getting a clot from AZ vaccine. So there you can clearly see there is an imbalance there. The risk from the vaccine is much more significantly lower than the risk of you smoking or getting the infection. So that brings me to the conclusion. And I just want to conclude to say that being Black, Asian, or from another ethnic minority group, we are 4 times more likely to get COVID infection or die from COVID infection. The vaccine is our only hope of medicinal intervention to protect us from the deadly disease. So please do consider taking the vaccine, because the benefits of the vaccine far outweighs the risks that you would get from the vaccine. Far outweighs the risks. Thank you very much.
Thank you, Mildred. An absolutely outstanding presentation, really clearly delivered. Thank you so, so much. A lot to take in, and I'm sure that people who are listening are internalizing what you said. And if there are people out there who are uncertain, please use the chat. If you click on the chat at the bottom of your screen or the side, depending on your device, a box will pop up. You can pop your question in there, and in our panel discussion, which we'll have shortly, we'll be able to answer those questions. So don't hesitate. There are no questions that are not worth asking. Chances are, if you ask a question, somebody else is thinking that very point. So please, let's have your questions coming through for the panel. So once again, Mildred, thank you so much. Now, I'm going to invite Pastor Nick Chanda to join us. Pastor Nick is from the Revival Christian Church of Enfield, very well respected in our local community, and would like to share his thoughts with us this evening. So Pastor Nick, over to you. Are you there, Pastor Nick?
Yes, I am.
Welcome. How are you?
I'm fine, and how are you?
I'm very well indeed. Really looking forward to your contribution this evening. Thank you.
Thank you. Good evening, everyone. I'm Pastor Nick Chanda from Revival Christian Church of Enfield. We're based right in the town center of Enfield. And looking at the subject, I'm going to speak basically on behalf of the people of faith And as people of faith, we have one belief, that we believe that God saves lives. And because we believe that God saves lives, he wants to save lives, so we partner with him in trying to save lives. And so when the issue of the vaccine came up, and of course COVID-19, there's no person that I've met who hasn't known anyone or any relative or distant relative or friend who has died to COVID-19, whether in the UK or back in Africa or in the Caribbean. And so we took it up as people of faith to pray, but not only to pray, but we thought of faith with works. And so right now where we stand, wherever there is a cause, wherever there is a challenge in the community, we have seen people like Mother Teresa who rise up. We have seen people like William Wilberforce would rise up to help to correct the situation. For us here in Enfield, one thing we want to do is to give an opportunity to educate people concerning the vaccine, to see both sides of the argument, to have that opportunity to have information, because we know even God always gives information to his people, and you tell them, I have a land for you, I have this for you, then they will follow through that information. We also believe that it's important as people of faith to create awareness of what is happening at such a time as this, or notify as many people as possible so that everyone would get quality information. They can then make informed decision based on that. There are many things that have come to learn in this course of life, especially under the COVID-19 situation. As a pastor, there are many times that we have been invited to go and pray for different people. We pray before we'd go to their homes, but now we are faced with praying just on the phone because things have changed. But also we have come to learn that as pastors, we have to take a lead. And to take a lead on this, personally, I made an informed decision, and I can show you something. This is my card that I took my COVID vaccine on the 28th of March. Why? Because I made an informed decision as a Black person and as a leader to lead by example, to prove that some of the things that I was told that I'm going to get a 666, I wanted to go and see it for myself. I didn't get 666, which means it wasn't valid. What can we do? I call upon everyone at such a time as this to utilize the opportunity to save lives. As a church, we have not met in our physical church building for over 1 year. And so we said, we can't let Enfield die, but we'll give our building for a pop-up clinic for one single day from 10 a.m. this Saturday to 4 p.m. so that lives can be saved. And that is why our contribution to the fight against COVID-19 in the borough of Enfield. Please, I would really appreciate if you join us in this fight. I call upon the whole of Enfield. Thank you.
Thank you very, very much, Pastor Nick. And very, very powerful message from you to the community in Enfield. And thank you for offering the church as a pop-up vaccination site. I stress again, I go back to my point, trusted people, trusted places. And for your community, there's no more trusted place than your church. So thank you so much for that. We have one more speaker before going to the Q&A, and apologies, I invited you to put your questions in the chat when actually it should have been in the Q&A box, forgive me. We've already received a number of very, very interesting and helpful questions, so I look forward to engaging the panel in those questions in due course. But before that, can I invite Avetta McInnes, who is the chair of the Enfield Caribbean Association. And Avetta, you're going to share some thoughts with us this evening. So Thank you very, very much indeed.
Good evening, everyone. Thank you for inviting me to be here. Yes, as has been said, I'm the chair of the Enfield Caribbean Association. We're a charity, a small charity in Enfield with big ideas. That's how we describe ourselves. I just want to say thank you so much to the speakers this evening who've so clearly shared their thoughts, their views, and their absolute compassionately about taking the vaccine. Just to share from a personal perspective, my personal story. When COVID first came about, I had lots of questions, was very concerned myself, and had many fears. We know that there was mistrust about the actual COVID itself, and there were lots of WhatsApps going around, videos, which were telling us that COVID didn't even exist. And some were telling us that COVID was there to kill Black people. There was so much misinformation being shared. I had to make a decision that I was going to seek advice and knowledge from other places and not just WhatsApps. And in the end, had to make a decision to ask friends and others who were sending those WhatsApp to stop sending them, because after a while I realized that a lot of it was untruths and lies, in fact. So I started reading the NHS websites. And then in April of last year, I was personally hit with the loss of my cousin, who was very ill in his 70s, 71, and sadly after a battle, died after 8 weeks. This really shook up the family. At that time, we had a significant number of cousins, I did, who were not going to take the vaccine at all. And then they were hit by the reality of losing a very close loved one. And then I lost two elders. We lost two elders who were in our Enfield Caribbean Association, who used to attend our luncheon club. And then I lost two school friends who were my age. So I lost 5 people throughout the year. And then we had the news of the vaccine coming around. And I thought long and hard and realized that the choice was, as Mildred has said so clearly, it's a choice between life, taking a risk of having death face you, or life. That's how I saw it. Those were the alternatives. The vaccine meant you had a chance of, if you got the COVID, having much milder symptoms and a good chance of living. If, as I was seeing with a number of Black people who had died, most of them I discovered afterwards, because people don't tell you that they've got diabetes, they don't tell you that they've got high blood pressure, they don't tell you they suffer from asthma. You discover afterwards that people are carrying all these underlying issues and that they were much had much greater risk. It was really good seeing the actual data and statistics, and to hear that 3 million people have died. The population of Jamaica, the country of my origins, is a real shocker. So when the opportunity has come for the ECA specifically to share our views, we've taken them. And then in January, I was finally offered the vaccine. I took it. I took it happily. And I must admit, in talking to cousins, to relatives, to other people, they've been, some have been shocked because they're so wrapped up with other Black people who are not taking it. Listening to a personal story is very powerful. As has just been said by the pastor, when people hear that you've taken it and you're living and you're fine and you're well and there have been no side effects, it affects them and it changes minds. I've found that testimonies and personal stories have been the most powerful in changing people's minds. So I've now had my second vaccine. I feel free. I feel so happy that I can now go anywhere. That's how I feel, and be free to live rather than risk dying and risk being seriously ill. So I just want to say that as a result of that, in the ECA, we have kindly had the vice chair have his photo, as we saw of some of the people at the beginning, on our website, which people can see, because our message is loud and clear. Take the vaccine, take life. Thank you.
Thank you very, very much indeed. And of course, having had your second vaccine, I am sure you are continuing to follow all of the protocols. I can see Mildred nodding there and reminding us all about the protocols of hands, space. Okay, jolly good.
Distancing.
You're not running around hugging people and so on and so forth. Okay.
Mask and following the protocols to each deadline and date as the government gives it. Thank you for mentioning that, Shane.
Thank you. No problem at all. And thank you very, very much for your testimony, Aveta. You're absolutely right. That's what makes the difference when people hear personal stories, personal experiences. So I'm sure those of us who are involved in this evening's webinar would all thank you for sharing that with us. So thank you. Now, in the time that we have available, we're now going to move into our Q&A session. So we are very, very lucky to have a tremendous group of experts and community leaders who together will be invited to respond to the questions that have been coming in. So thank you all for those questions. I'm going to do the best job I possibly can to get as many questions through this evening as possible and invite our speakers to answer them. So if that's okay, if we're all ready, perhaps we can go to our Q&A. So welcome, panel. I'm going to start, if I may, with a question about fertility. And this is a question that I'd like to pose to Dr. Nikita. And the question is, does COVID vaccination affect fertility? And can pregnant women or women who are breastfeeding be vaccinated? So Dr. Nikita.
Thank you, Sadi. Good evening to everyone, and thank you for joining us this evening. So the fertility issue, and will the vaccine affect your chances of having a baby? You know, a lot of people have come back to us and said, no, I don't want to take the vaccine because, you know, it hasn't been tested on pregnant women. It can't be safe for me or for my future baby. So they're right. Pregnant women and children are not routinely included in any drug trials. But we do have statements from the president of the Royal College of Obstetricians and Gynecologists and from eminent scientists that say that there is no evidence to suggest that the vaccine affects your fertility. If we look more recently as well, we've seen no safety concerns identified with either of the brands of vaccines currently available in the UK in relation to pregnancy. And we are also now collecting real world data. So the United States have now shown that around 90,000 pregnant women have been vaccinated. Maybe, you know, they got the vaccine before they even realized they were pregnant. And there have been no safety concerns, and there have been no problems with the babies after delivery as well. So, you know, it's a powerful number. I'm sure going forward as well, we will see more and more females vaccinated who become pregnant. And, you know, we are being told by Public Health England, by the Joint Committee on Vaccination and Immunisation, that it is safe for pregnant women to have the vaccine. The preference is to go and have the Pfizer, BioNTech or the Moderna vaccine, especially since this is an age group where you are likely to be under the age of 30. But there's no evidence to suggest the AstraZeneca is unsafe. So if you have had the AstraZeneca and you have now found that you are pregnant, it's perfectly safe to go and get your second dose. And if you are pregnant and you have been invited because of your health conditions, then please speak to your GP about organising to have the Pfizer or the Moderna vaccines locally. Thank you, Cindy.
Thank you so much indeed. That's a very comprehensive answer. Thank you for that. Another question's come in. COVID vaccines were developed so much faster than other vaccines. Have corners been cut in development, and how do we know it's safe? Now, I'm going to start the response to this question, or invite Ben Menser from BEH to kick off the answer, and invite other panel members if they wish to chip in afterwards. So Ben. Ben, you are on mute. So that's £1 into the North Mid charity. Anytime you're on mute, it's £1 to the North Mid charity. So thank you, Ben. And you're still on mute, Ben, so that's £2. While Ben is coming off mute, anybody else? Ben, anybody else?
Not. The vaccine,
thank you, Mildred.
Thank you. So, you know, in the UK, we have the regulators, the MHRA, the Medicines and Healthcare Regulatory Authority, and they're tasked with actually ensuring the safety of every product that's on the shelf with regards to medicine. So when a vaccine or any product is being developed, it takes quite a number of years. That is because you do the process in a staged approach. So you would start with probably firstly identifying the drug, the structure of the drug, and then you make sure that it's safe by testing in animals, and then move on to phase 1, phase 2, and what is called phase 3 trials. So at each stage, you're trying to determine the safety of the drug, what dose might be safe, looking at what side effects that you would get, looking at, is it worth it? Is it effective? So those are all the data that's been gathered. But as I said, they will do it stepwise, one after the other. You complete one and then you start the other one. With this COVID vaccine, it's a pandemic. Remember, we were all, most countries were in lockdown, okay? Normal activities were not happening. It meant that the scientists had the time to focus in groups, to focus and look at the vaccines, to study the vaccines and its development. So all efforts, finances were actually thrown at this. So it meant that rather than doing things in a stepwise manner, they were being done in parallels. And if you've heard that some of the trials were not done in one country, there were parts of the trials were done in different countries, that's because they all took charge of doing certain parts of the whole process. So this is why it was done quicker than we would normally see. But there's no evidence whatsoever that they did cut corners. They did not. Everything was done and looked at the right way, but it was done in parallel rather than done in after stepwise, one after the other. So that's the reason why.
Thank you. Thanks, Mildred. Any other comments or observations? No?
Yeah, just to add also to Millie's point as well, specifically, I would also want to just say that we saw quite a lot of strategic alliances, academic partners with pharma companies, and the synergy benefits that brings the quality of research, a huge amount of financial investment in building up of these clinical trials. If those of you have been following some of the updates from a Public Health England perspective, the Chief Medical Officer, there was quite a lot of exchange of sciences amongst nations, and how this unified the clinical bodies of the clinical world. It was absolutely amazing. So those strategic alliances has added strength to the quality of science.
Thank you, Adam. Thank you very much indeed. Another question's come through. Are there any animal products in the vaccine? Sita, would you like to take that one?
Hi. So I do believe that from what I've read and what I have been hearing so far, there are no animal products in this vaccine, and there's no, what I believe is that there's no alcohol, there's no pork, there's no fetal material, there's no mercury or aluminium. So I think, that it's quite good to read that, because then it re-emphasizes the point that has been already said, by Mildred and everybody else who have actually gone and read a bit more about the making of the vaccine.
Thank you, Sita. Another question, which is an interesting question, I suppose. Perhaps, why are there so many different vaccines? So again, perhaps Dr. Nikita, could you take that?
So as both Mildred and Adam have just said, we've had a lot of collaboration between academic institutions, drug companies, and people have been using some very innovative technology to bring these vaccines forward. And the ones that are currently in use in the UK, so we have the Pfizer, we have the AstraZeneca, and we have the Moderna, all use slightly different methods to get the actual instructions into your body. But actually, once they're in your body, what they are teaching your body to do is mount the defense against the COVID infection. So yes, they may be different in the mechanism in which they enter your body, but once they're in your body, they're all going to do the same thing. So it's about protecting yourself, and the vaccine will help to protect yourself.
Thank you. A question's come up here, and again, it's an open question. Is it possible that some side effects of the vaccine will only appear after many months? Who wants to take that one?
I can.
Thank you. Thanks, Mildred.
Right, with regards to side effects, so we know that the vaccine itself was tried in thousands. The original trial recruited, for instance, the Pfizer, I think it was over 40,000 people were recruited to the trial. So they got a lot of data there during that period. And then as we are going now into the rollout, it's quite sensible what is called surveillance. So the MHRA is gathering data as we go along. The vaccine was authorized based on the side effects that were presented as part of the clinical trials. So there's no way the MHRA would approve something if it wasn't safe. So what was presented at that time enabled the authorization. The surveillance would gather anything that had not been picked up in the trial. So far, most of the side effects that were listed during the trial have been represented in the rollout. So the mild side effects like headaches, injection site pain, what else is there? You've got lethargy, you feel tired and painful, muscles after. Those are the common ones. We don't know, and that's the truth, in the long run, what those side effects are. But based on the studies and based on the actual principles of the mechanism of the vaccines, we're not predicting any potential hazardous side effects. We know what's happened with the AZ, and this is why the MHRA is taking up very robust actions now at this point. So you can never predict truly and faithfully what might come in the future. But you've got to look at the evidence that you've got and kind of give a trajectory on what might happen, but you cannot be definite for sure, and act upon take actions as quickly as you see these events, these adverse events occurring, which is what has happened with regards to the AZ and thrombosis, although, like I said, there's not a definitely confirmed link to the vaccine at this point.
Thank you, Mildred. Thank you very much indeed. Ben, welcome back. I'm just checking, Ben, that you're now able to unmute yourself, because last I calculated, you owe the North Mid charity £10. Are you with us, Ben?
Hear me now?
We can hear you now, Ben. That's absolutely fantastic. So let me pose this question directly to you, Ben, as a welcome back to the panel discussion. Can the vaccine genetically modify me?
No, the vaccine cannot genetically modify you. It's not possible.
Don't shoot the messenger. It was a question that came through, because of course we've all seen, and I think, Abessa, you might have mentioned it earlier, the videos that have been going around, the social media, you get WhatsApp messages, and these are questions that people genuinely ask and want answers to. So our collective role here this evening is to provide assurance to people, to give them the confidence to take the vaccine.
Yeah, I think that, you know, a lot of people are anxious, Sedi, and it's okay to be anxious. You know, this is a new thing which has just been developed, so people are going to have all sorts of ideas, and I think it's up to us to, you know, to assure them, like you said, that, you know, it is a safe vaccine to have. I've had my vaccine, you know, and I'm alive and well. I'm here, and I'm very glad to have had it, because I want to get back to normal. You know, I want to live my life again. So, you know, go back to the question. No, it doesn't alter your DNA.
Yeah, thank you very much. Dr. Lannery, welcome.
Yeah.
Can I ask you a question? Because this is about where people go to get objective, clear, authoritative information and answers to their questions. Where would you recommend people who to turn to if they have doubts, if they have questions?
Thank you. Sorry, I've had an itch with my mic. Yeah, I think the thing to do is that if you have any questions, is to go to people who have actually experienced, first of all, any question have experience about COVID vaccine, go to your GP, go to your local leaders, because the COVID vaccine we know is very, very safe. I have had experience of it. I've taken my 2 jabs of the COVID vaccine, and it's a very safe and effective way. It gives you the best protection against coronavirus. So approaching your GP, approaching the leaders in the community who are by their shared experience can tell you that it is safe. And there's been a lot of issues about the fact that there was the speed of production, which was what I wanted to answer before I had the glitch. The speed of production. If you have the collaboration, international collaboration that the COVID vaccine have had, the resources that will be put in by globalization, the fact that while the experiments was going on in the lab, everything was going on in parallel. You have the experiment, the phase 1, phase 2 trials, they were all going on in parallels. So it makes it easy because there is money, there is no barrier to funding, there is no barrier to resources. Most international government came together it's a concerted effort of international groups. So that is why there is that speed of production. So if you want information, there are so many around where you can go to your GP, you can come and speak to people who have had experience about it.
Thank you.
Thank you.
And if the person you go to, if they don't know, they will know someone who does know.
Yeah.
And I'm loving the nods on my screen. So thank you all very, very much indeed.
Can I just also add a comment?
Yes, Adam, of course.
From what Dr. Doroje said. There's also recognition on the impact of health literacy, the ability of the information given to people to actually understand it. And we see this even with digital technology. We talk about digital literacy. And it's very important also to pencil that there is resources now available from some of the colleagues who speak who are multilingual, or some other resources in different languages, information in Swahili, information in Somali language, different languages, and quite important, again, if people need those additional support as a resource mechanism, it is available. And then the last thing I would also say is a way of responsibility, and this is now talking from experience, is that if you find information doing the rounds, especially on social media such as WhatsApp, let's also have the responsibility to put a stop to rubbish information. Whilst it looks so exciting to circulate information which is with so many inaccuracies, it does more harm than good. You might be saving lives by just putting a stop to information that is circulating during the rounds, which is irrelevant.
And can I add one other thing?
Of course you can.
Is that we need to reassure our community that the NHS will not offer COVID vaccine to the public until experts have signed it off, and that it is safe to do so. So the MRSA is an official body, and they've conducted rigorous and robust studies to make sure that it is safe. It is just to make sure that, I want to reiterate the fact that the COVID vaccine, it is safe, it is effective, it is the best way out of the pandemic. And when I listened to the pastor earlier on about people of faith, it is very important to know that if we agree that the Almighty is the custodian of wisdom, knowledge, and understanding, it is the Almighty that has actually impacted this knowledge to our scientists and our researchers to be able to know how to develop vaccine. So when we take the vaccine, we're actually glorifying the work of God.
Thank you very much.
Thank you.
Indeed, thank you. I'm conscious of time, so we've got 10 more minutes of Q&A and conversation and discussion. Another question has come in, which is an interesting one, actually. Can natural remedies protect me? Mildred, can natural remedies protect us?
Thank you. So there's been a lot of articles published and small studies around the usefulness of things like vitamin D preparations for COVID. There's nothing like a natural remedy that could actually prevent COVID-19. It's like, it's probably, you're asking, you want to scale a mountain, Everest. It's like you're trying to scale Everest, and you need the power and tools to do it. You can't go as a weak man or a weak woman. So there's nothing as a national remedy that would prevent you. What you can gain from having natural remedy, and these are things like healthy eating, is you're empowering yourself, building up your body, building up your system, so that if you do get, unfortunately get COVID, you're in a better place. Your body is in a better place to weather it. But it can never prevent you. There's no evidence that it can prevent you having it. So I started off with vitamin D as well. So that's the relation with vitamin D. There is some evidence that with vitamin D, you build up your immune system. It helps you fight common colds. So it's just about building some resistance within your immune system, but there's no way it can prevent you. There's no evidence for that.
Thank you, Mildred. Thank you very much indeed. I'm going to speed up a little bit now because time is not our friend this evening, but this is really, really helpful. will we need more COVID vaccines in the future or against different variants? Who wants to take that question? If you don't volunteer, I will volunteer you.
I can start off.
Thank you, Dr. Lannery.
I think we will probably do, because if we know that the coronavirus is very closely related to all the coronavirus like flu, I have a feeling that we may in a year's time need booster dose like we have flu jab. But that is not going to be any problem because the template is there to produce more vaccine. If we know that we get flu jabs every year, and there is a template to produce flu vaccine, my opinion, my belief is that we probably will have to have booster doses maybe once a year or once ever so often. That's what I think.
Thank you. Thank you very much. And I'm sure that the answers to these questions are really appreciated by the people on this webinar. So thank you very much indeed, panel. A couple of more before we hand over to Marcus. And this is to everybody, really, because I think for me, this is a discussion item as much as anything else. There are some members of my community who often refer to their mistrust of Pfizer and the vaccinations being tested on African people or poorer people in general before they were safe. Pfizer earns a lot of money. Can we trust pharma companies? This is an open question. Anyone can kick us off, because this is a question that has been posed to me by more than one person in my experience. This lack of trust of the big pharmaceutical companies who only want to make money, who want to test on African people and so on. We understand some of the history, but any thoughts on that? And you're not here as a spokesperson for big pharma, okay? Nobody wants to take the question. Okay.
I could start.
Thank you, Ben. Please start.
Well, I think first of all, I mean, for example, AZ, they are not making any profit for the first couple of years in developing this vaccine, so we can trust that, you know, they are doing the right thing. And also, I think with COVID, there's a lot of spotlight on the pharma companies, and there's a lot of regulations, and you know, the regulatory bodies are not going to sit back and let the big pharma sort of do what they want to do. This is quite important. You know, this is for the whole world, really. So if we get it wrong, you know, the whole world is getting it wrong. So I think that the scrutiny and the rigorous trials that is taking place, I am assured that, you know, the big pharma are not just, you know, out here to make profits out of us, because, you know, this is a global pandemic and we need to find a solution to it.
I would agree. Any other thoughts or comments from the panel?
Seti, I think it's probably worth adding as well that when the vaccines were first produced, one of the questions we received the most in the NHS was, had there been any trials involving ethnic minorities? And the data for Pfizer and AZ showed that, I think I'm right in saying, Mildred will correct me if I'm wrong, it was around 10 to 15% for both trials, ethnic minority people were involved. So this wasn't overly tested on ethnic minority communities as such. I think there was an absolutely fair and transparent process. And as Ben said, this scrutiny on this particular vaccine production was very helpful in this instance. The other thing I will say, of course, is some of the mistrust around Pfizer is for justifiable reason, given what happened with the Trovan medication in Nigeria. Interestingly, when the vaccine deployment program was being developed by the NHS, you know, I'll be completely upfront about this. I think some of these historic issues around the big pharma companies potentially was
not as understood as it could have been, if I could be diplomatic. So, you know, some legitimate questions around Pfizer, but in this instance, I think it's fair to say, as Ben has, that this has been done in the right manner, and the vaccine is absolutely safe for all ethnicities. Thanks, Eddie.
Thank you very much indeed, Marcus. Thank you.
And also, just to add on the question of trust, it doesn't necessarily come as a surprise, because we know uptake from our community in terms of participation in clinical trials, it varies a lot compared to other population groups. So from my experience of having worked in clinical research facilities, Moorfields, for example, uptake of clinical trials, it's always quite a challenge. So there is a trust around clinical trials. But when we think about the practicalities in terms of establishing good clinical trials, there's protocols, there's clinical leaders' expert opinion, there's whole things around ethics. And these vaccines, like everybody has said, there was a lot of scrutiny. There was a lot of, every measure that was put in place to just make sure that things were safe.
Thank you. And one more question, which I hope is a good question to finish on. Would you recommend your parents to take the vaccine? Pastor Nick, what do you think?
I'll definitely recommend my parents to take the vaccine so that they can live longer, and I would enjoy being with them more for a longer time, rather than them having their time taken by COVID. So I'd recommend that to my parents.
Thank you very much indeed. And can I thank you, panel? Really, really insightful responses. Apologies for putting you on the spot, but I think it's called the chair's prerogative. So I hope you will forgive me. But I hope those people taking part in the webinar will take a lot out of this. Before handing over to Marcus Riddell, just to conclude this evening's webinar, what I will say to those people who are taking part, if we haven't been able to answer your question, there will be all of these questions and answers placed on the Enfield Council website. So if we didn't get round to your question, please go to the Enfield Council website, and your question and the answers will be there. So once again, on all of our behalves, can I thank you, panel, very, very much indeed. And can I hand over to Marcus Riddell from NHS England, who will take us out.
Yes, thank you very much, Sedi. So, as Sedi said, I'm Marcus Riddell, I'm the Head of Equality and Inclusion, Evidence and Policy for the NHS in England. I've also just finished a stint as the Head of Staff Vaccinations for NHS England as well. So, really happy to be here. And most importantly, I'm sure for everyone listening, I'm from Enfield. Not born but bred in Enfield, and I'll talk a bit more about that in a second. Before I do so, correct me if I'm wrong, but I believe we're going to have a couple of poll questions. Is that correct, Riyadh?
Yes, that is correct. So if we could get the last, thank you very much.
Great. So first question for everyone. Are you hesitant and unlikely to have the vaccine, yes or no? And there'll be one more question coming shortly, everyone. Are you likely to have the vaccine? Yes, no, or undecided? Riyad, will that be the final question?
Yes, that's the final question.
All right, thank you very much. I didn't want to talk over any of the questions. So I'm going to wrap up. So as I say, I'm in Enfield as we speak, and this is the borough in which my grandparents and my dad's side of the family settled as part of the Windrush generation. And actually, unsurprisingly, I guess, in my job as head of staff vaccinations, I was often asked by colleagues why confidence in the COVID-19 vaccine was so low for African and Caribbean communities, and particularly low for Caribbean communities, and Caribbean staff in the NHS is very low indeed. And I'd often respond by saying, how long have you got? Because actually it's a long story, and it goes all the way back to when our parents and grandparents came here. And even in Enfield, it's interesting for me, you know, I have a lovely family here, and I have a lovely house here, and I can walk down the street untroubled, but it wasn't always the case, as some of you will know. It wasn't necessarily easy. It was hard to get access to healthcare and access to good education. It was hard to get a good job. And this started a long time ago. And why that matters is because you can come to the UK now. So you could be you could be trained in your profession as a let's say a Nigerian. You could come to London. You could settle in Enfield, and you could still find it hard to get a good job and get good access to healthcare and get a good education. So those inequalities have remained for some time. Now, you could say they haven't been addressed, and I know some people have said to me quite directly, NHS staff, so these are, you know, well-informed staff who well understand the safety aspects of the vaccine, have said it's not that they've not been addressed, it's that they've been accepted, it's that they've been ignored, it's that people have not listened to us. And people will give me the statistics that, you know, we all know very well, and it's no different in London. So it goes without saying now that every time there's a report on achievement in education, it's highly likely that Caribbean children are going to be there as the lowest achievers. Black children are certainly more likely to be excluded. We know about the statistics on black mothers being more likely to die in childbirth. We know that black people are more likely to be unemployed or in low-paid employment, and so on and so on. And all of the things that Mildred talked about, all of those inequalities, more likely to have comorbidities is obviously a really big one for health reasons, are the reason why we've been more at risk from COVID. Now, again, even when I say these things, sometimes people say, well, what does that have to do with the vaccine? Well, what it has to do with the vaccine essentially is for a lot of black people in Enfield, in London, in the country, there's a feeling that the authorities have not listened to these concerns, and it's led to the disproportionate impact of COVID. So being black in and of itself is not what's put black communities at risk from COVID. It's all of the inequalities I've mentioned that's led to this point in time where we are more at risk from COVID. And that's really what's happened here. So I guess the first thing I wanted to say is it's really important for the NHS and for the government, but also right here in Enfield in the borough. I'm pleased that the council and the local health organisations have given up so much time over the last few weeks to listen to the concerns of African and Caribbean people in the borough. You know, this is, I hope, not a moment in time, but a change in the approach. And certainly for the NHS, we are absolutely determined that this is the beginning of a new approach to how we engage with ethnic minority communities in this country, because it's through listening and through listening to the concerns and addressing those concerns that you increase vaccination uptake, but also a myriad of other issues that I've mentioned and Mildred mentioned about the inequalities in this country can start to be addressed. Now, having said that, it all sounds really negative, doesn't it? It's all really bad. You know, we've had a bad experience. Yeah, of course, we haven't had a negative and bad experience. In fact, for many of us, I look at this panel and the audience today, we've settled in the UK. We're happy in the UK. We're happy in Enfield. We've had good lives and our families are happy here. And that leads me to my last point, which is that our stories are unfinished. And unfortunately, as Avetta said, for some of us, our stories are finished, I would say, before our time. And COVID took the lives of some of the people we love early. And for those of us who are still here, we now have a chance to carry on and to be free in the way that Avetta describes it. And whilst we may not be returning to normal yet, and I know for some people, normal in and of itself was part of the problem, as I've just described, in terms of the inequalities we face, we've got an opportunity now to look forward to the future with some optimism, and we must not waste it. So I must encourage everyone listening, please take up the offer. If you've already had it and you're not sure, we're not forcing you. There's still time. And as the council and the health organisations in the borough have circulated, if you're in one of the priority groups, you can book it yourselves. So, you know, take this opportunity. You will not regret it. And I really, really hope that these conversations will continue. I hope you found this informative. And in the interest of time, I will stop there. So thank you very much, everyone, for joining us. And Sedi, any last words from you?
I think people have heard enough from me, but thank you all very, very much indeed for taking part in this webinar. Echo everything Mark has said. The story has not been written yet. We can write our own story. By working together, supporting each other, we can all get through this. So thank you very much indeed. I believe there's going to be another pop-up slide. There we are. So I leave you with this slide. I wish you all a wonderful evening and thank you all very, very much indeed. Thank you, everybody. See you soon.